Hi, I'm Ronald Leidenfrost. I'm the chairman of the Heart and Vascular Institute at St. Luke's Hospital in Chesterfield, Missouri. And I'm one of the heart surgeons here, together with my son, Jeremy Leidenfrost, and Michael Ryan Reedy. I started at a community college and did 2 years there. Went on to the University of Rochester, where I spent 3 years in doing a double major in mathematics and biology. And then I went on to medical school in Syracuse, New York at SUNY, upstate Syracuse, where I completed my medical degree. And following that, I went to Barnes Hospital, where I completed a internal medicine residency, followed by a general surgery residency, followed by a year of pediatric cardiac pathology in Boston, at Boston Children's Hospital, followed by the cardiothoracic surgery fellowship at Washington University Barnes Hospital at that time. I completed my education and went on to become a Washington University assistant professor at Jewish Hospital, where I continued clinical training under John Connors and Jay Sanza. And following that, I was appointed to become the chief of cardiac surgery at the new program in Chesterfield, St. Luke's Hospital in 1984, where I've been in practice for the past 35 years. My wife of 44 years, Tony Leidenfrost, and I have 5 children, 3 boys and 2 girls, so it's a full house. And Jeremy was the oldest and is the oldest. And Jeremy has chosen to more or less follow in my footsteps. I'm a regular swimmer. I like to swim every day. I'm a snow skier. I like to go out to Colorado and to Utah to ski. We have participated in the St. Luke's Midwinter Conference for a great number of years, and we've always had the idea that the greatest thing about going out to the mountains is that no man is greater than the mountain, and you always come back wanting to be healthier and to always do your best. My specialties in cardiac surgery include adult cardiac surgery, which includes bypass surgery, coronary artery bypass surgery, including on-pump and off-pump beating heart, aortic valve surgery, mitral valve repair and mitral valve replacement, and also the treatment of thoracic aneurysms of the aorta. My approach to patient care is basically one of doing for people what I would want to have done to me. I take a lot of time with patients, sit down with them, with the patient and family, to make sure that they understand what the procedure is, what the risks are, what the recovery time is, and the alternatives to the procedure, if any. Most of my patients would describe me as intense and committed to quality, and one of making sure that all the members of the team are aligned so that we get a good outcome. One of the unique things about my practice is that I essentially was trained as an internist, and the old motto in internal medicine is you never turn your patient over to the surgeon unless it's absolutely necessary. So I don't do surgery unless I think it's absolutely necessary and in the best interest of the patient. And as far as our entire team approach, I think that I've been able to foster that as one of our rules. The cardiac surgery program here has been given the citation by Healthgrades of being top 50 in the United States for cardiac outcomes in surgery. And we not only got that in 2019, but also in 2020. Well, when I was growing up, I grew up on a farm, and both of my parents had 8th grade educations. I was the first of my family to complete college. When I completed college, or when I was in college and expressed the idea of going to medical school, everyone told me that I could never do that. So it's always been a challenge to me that I've always tried to do what was challenging and what would hopefully bring out the best in me and those around me. The most important thing about working at St. Luke's to me has been the commitment of the institution for the very best nursing care. You can do a great operation, but if you don't have the nurses to take care of your patients afterwards, there are too many pitfalls in the recovery road that can cause you to fail. And so the continued commitment of St. Luke's to that best nursing care is the one reason why I continue to work here.